Welcome to the HITea with Grace podcast, where we spill the tea on HIT. Today I'm live at the Civitas Conference, a fantastic event filled with healthcare technology leaders in the health information exchange space. Today I'm honored to chat industry trends with John Lynn of Healthcare IT Today and the Sway Health community. So tell me a little bit about yourself before we get started.
Yeah, thanks for having me on, Grace. It's always fun to chat with you. For those that don't know me, we have a health IT publication called Healthcare IT Today. We've done about 19,000 articles over almost 20 years. And we have 4 different health IT podcasts as well that are all video and audio. So an amazing community which will provide valuable content for them to know how to improve healthcare technology and their use of healthcare technology. And then, as you mentioned, we also have the Sway.Health community, which is our healthcare marketing community, which you're a part of, a great member of. We bring together the best healthcare marketers.
Fantastic. John and I sit in a very unique space in this industry where we're hearing a lot about a lot of different trends. And so here at the Civitas Conference, we're hearing a lot about trends happening in the HIE community. And now that we know that everyone's kind of on TEFCA, right, or should be, and everyone's a network, the conversations here have been talking about and really centering around what's the future of HIEs in this new world. And they truly believe there is one. What are some of the trends that you're hearing about?
Yeah, I think that is the question. How is TEFCA and QHINs going to impact HIEs? And I think most of the people here at the Civitas Conference, who are largely HIEs, are looking at it and saying, I don't think TEFCA and QHINs know what they need to do to provide value to the end users. I think it has given them a little kick in the pants to say, we should be providing more value to users. So it's not so much, can we share data from point to point, but now we'll share data and make sure that the data that we're sharing provides value to whoever's receiving that data. So I think it's going to accelerate everything that they're doing. But I think most of them aren't too concerned by it because they realize that when the rubber meets the road, healthcare is local, and you need to have that local understanding of laws and compliance rules and needs of the local community to be able to make it successful. So I think most of them are saying, we know what we're doing in our local community and the value that we're creating. And so they're not that concerned, although they're saying, let's accelerate and make sure that we stay around because we're providing value together.
It seems like this time last year at the conference, they were really concerned about funding and where are we going to find the funding to stay afloat? And the recent CMS rural bill put $50 million towards kind of rural health. And they're seeing this as an opportunity to invest into HIEs and interoperability. And given the government's stated goals of making sure the world is more interoperable in the US, they are very excited about the potential of that. That said, they're still wondering how exactly they are going to continue to pay for things and how they are going to fit into that kind of rural health bill and what they're trying to do with that. And so some of these regulations that are coming out are in their favor, but they have to pivot and figure out like how they fit into this new world. And that's a tricky space to be. What do you think their strengths are playing into that side of the house?
Yeah, and I think it is interesting because most HIEs started with funding from like the HITea Act. A few of them were before that or maybe benefited from that. And a lot of those disappeared, actually. They got a bunch of one-time funding and then they disappeared because they didn't find a business model. Those that have survived found another business model outside of government funding in many cases. Some of them were more local. There's some New York funding and different things. Even New York City funds some of the HIE there. But a lot of them have had to find other revenue models, including from providers and from payers. But to your point, the challenge is that those providers are making less money. And so they don't have the money to pay to the HIE. I heard one leader of an HIE tell me, hey, listen, our providers are saying, we need you to be cheaper. And they're like, well, we can't be cheaper. And I'm like, yeah, but the risk is they just stop using you altogether. And he said, yeah, that's right. They'll say, I believe in what you're doing, but I can't afford you. So they're going to come back 3 months, 6 months, who knows, right? But so I think that's the dynamic at play is these provider organizations who are funding the HIEs based on usage, based on size, things like that. They're just not going to have the money. We see that on the health IT side, right? Health IT companies are like, they can't buy our products because they don't have the funding. Well, the HIEs are being impacted similarly.
And it seems that in the payer world, CMS 0057, payers really have to share data and be interoperable now. And so HIEs are saying maybe that's our play, like working with payers and helping them be more interoperable. And that local data is so critical and so helpful. And so is it going to be working with providers, or is it going to be working with payers, like you said? And what is that business model going to be to keep us moving forward? Or is it collaborating with QHINs and getting creative on a partnership model that works in both companies' favors and both networks' favors? So that'll be an interesting thing to see. There's a lot of promise and hope and uncertainty.
Yeah. And I think what's interesting there is the payers want all the data. They're going to get the data. The only question is who and how, right? So Epic's making a play there, right? ECW is connected to tons of health plans, right? So the EHRs are going after and saying, hey, let's collaborate together and share data. The plans are going to get it. The question is, are the providers going to work with them? Are the HIEs going to work with them? Where are they going to get the data? But, I think what's interesting that I heard from a number of people here was before the HIEs were like, why should we collaborate together? Healthcare is local, like should regional share with regional? And now they're saying, yeah, we should collaborate together. We should create some sort of standard across HIE. So instead of working with the QHINs or payers, which they probably are going to do some of that too, they said, what if we work together so that if you're an innovator that wants to innovate on top of this data, I don't need to go to 15 different HIEs that have 15 different data models that I have to integrate with. That's not a strategy that works well to work with all the innovation that's coming. So they're saying, should we work together and provide a more standard process for the innovators, the startups that want to leverage that data to do good for providers, for payers, whoever it might be, and then even just exchange the data between it. Then I don't need the QHIN. If I have all the data for Oklahoma, as I heard one guy say, then how about we exchange Oklahoma with Nevada, right? Like, why do I have to 50 is better than how many QHINs and how many hospitals there are?
Exactly. It's just data is king, right? And they have data and they have code. So between the data and the code they've built, they should be able to have a great business model moving forward in what the future of healthcare interoperability, to forward the future of healthcare interoperability. Another thing that I've been hearing a lot about is this idea that in order for HIEs to really continue to exist and provide the value that they need to show, they need to get their patient identity and patient matching right. So I kind of want to talk a little bit about that. Like, what is going on in that space and why are they talking so much about that? Literally every single panel has talked about patient identity, patient matching, and then also patient consent and how challenging that is to get right.
Yeah, I actually think consent in many ways is almost harder than identity.
Yeah.
Because consent has so many layers, especially when you do pediatrics and behavioral health and, all of the data that's there and can you share it and in what context? Is it the health use case? Is it the operations use case? Is it like... That's really complex and it's going to take time to figure out what is the right way to do it. I think when it comes to identity, it's a problem that can never fully be solved. And so that's why we're going to hear about it forever. Like, we can improve what we're doing, and many have. They all have master patient index. If they don't, then that's a problem. Like, it's going to happen, right? And so, they're doing things to solve the problem, but it literally is a problem that can't fully be solved, because here's why. When a patient shows up to the ER in an ambulance and they have no identification on them, guess what? They're John Doe. They're put into the system without any information, and they're going to have that happen, right? And there's dozens and hundreds of cases like that when it comes to identity that mean that it's just not going to happen. Can we improve what we're doing? Yes, and we will, and it needs to be improved, so we trust that the data that's being shared is good in quality, but it's never something that's ever going to be fully solved. Kind of like interoperability, ironically. We're never going to have full interoperability. There's always going to be more to do. I think the same is true with identity. But I think what's interesting is the CMS efforts around identity may actually be the most impactful, because they may push it down so that we have identifiers, as Ryan Howell said on stage today. There's one thing as a digital identifier like social security number, but there's identifiers that say, I know who Grace is because of her address and her phone number and all these different characteristics that say, I know who she is.
And to put it into really human, realistic terms too, The desire is to kill the clipboard. Like, you should not have to go into the doctor's office every time and tell them who you are every single time. They should know who you are. They should know your patient history. They should not have it confused or complicated with another duplicate record that happens to be under your name in a different format. It should all be one format and in one place and be accessible no matter where you go. Like, patients and caregivers should not have to bear the brunt of health record fragmentation. I want to kind of talk about patient access now, because there are no incentives right now for HIEs to participate in patient access. And yet there are a couple dozen HIEs that are choosing to do so because they want to serve the communities that they serve the best they can. But what is the future of patient access unless there is an incentive? And why should HIEs really choose to do so? Because it's the right thing to do.
And I've heard a few say that. They're like, we don't have the incentive to do this, but it's the right thing to do. We should do it. But they are scared, right? That adds a whole level of complexity that they haven't really considered or been part of. I actually have more hope in the patient access on the QHIN side of things, on the EHR side of things, especially when it comes to information blocking and things like that. We could have the same problem with HIEs. They could be under information blocking if they're not sharing with the patient. So I'm interested to see how that evolves. But I do think that most patients are going to go through some other route than the HIEs. We'll see how it evolves and if some of them mature. But I don't know. It is a fundamental change in how they think about what they're sharing, because they were sharing between providers and between payers and whatnot like that. It wasn't designed to share with the patient. So I don't know if I have much hope to share, unfortunately, there. I think it's going to be a challenge for sure.
Yeah, it does seem that the incentives would have to be aligned along what you said, information blocking or the like, for them to really be able to all want to participate and support that effort. And I do think it's just best for patients and caregivers to have that option, even if it's not something they typically would be the first they pursue. Just to have it is helpful for them to be able to empower them to take care of their own health. That said, I think data movement is just as important for pharmacists, mental health providers, physical therapists. I mean, all of these other providers that are contributing to integrative care and whole health. And so I've been hearing a lot about social drivers of health and incorporating a lot of the data from sources other than simply like the hospital and health system. Have you been hearing a little bit about this fringe interoperability and what it looks like to really integrate holistically?
Yeah, we've been hearing about this for a long time, right? And incorporating that. And there was an interesting insight from the keynote here that talked about the Latino population. I think somewhat jokingly said, we know the common phrase, if we know where you live, we know your health. And he's like, no, we don't. It depends on what population lives in that place. Because if they're Latino, they live longer, they have less heart disease, they have less cancer, they have less. So he's like, there's a lot more nuance to this than I think we want to admit, is what I took from what he said. So I think it's interesting because when it is more like a community HIE, like we've seen, I think it's called 211 here in San Diego, in Southern California, they need that data to be able to do some of the work that they're doing. Some of the HIEs are not that mature. And so like they may even pull in that data, but then what do they do with it? And that's the big problem. And I think that is that next stage for HIEs to say, not only can I give you the data, but I can help you use that data to actually improve outcomes or improve your business or improve the patient's lives. Like, I think that is the next step for them, because it turns out data in itself doesn't do anything. And that's true whether it's health data or whether it's SDOH data. Like, okay, if I give the doctor and say, guess what? Your patient doesn't have air conditioning or have heating, and that's why they keep getting a fever. And what's the doctor supposed to do with that, right? That information doesn't actually change anything if it doesn't give them an opportunity to actually say, hey, here's some support. Here's a way for you to pay for heat so that then you don't get this fever again and you're not admitted again. And by the way, that's a good investment, because if I pay the $50 a month for your heat, now I don't have that $10,000 admission into the ED.
It really is all integrated together, right? And really those social drivers of health really supporting the patients and caregivers from their homes, right? More than just in the hospital. Well, this is an awesome conversation. Where can our listeners find you online?
Yeah, well, I like to tell people, if you can't find me, you didn't try. But if you search for John Lynn, you'll find a lot. But, the easiest place is go to healthcareittoday.com. Be sure to like and subscribe, as the kids say, to our podcast and follow along with what we're doing.
Fantastic. Thanks for joining me today.
Thanks for having me, Grace.
And thanks to you folks for joining us too. Check out the HITea with Grace podcast for more interviews with great guests like John today. Cheers.
Like a Girl Media is more than a media network. It's a community. We want to meet you and amplify your voice and the voices of outstanding women innovating in healthcare. Interested in starting your own podcast or hosting an event near you? Connect with us online or in person. We're here to support and empower you.